Antiepileptic drugs. First, you have to know what is epilepsy. Epilepsy is there is a formation in your cerebrum that discharge electrical impulses which are abnormal and they causes contraction of your muscle uh, for a short or long period of time. This is normally we call this fit. We call this as fit. So this is what is happening. So in our brain there is a neuronal formation which is abnormal that discharge electrical impulses, and for to treat that we use antiepileptic drugs. And the types there is mainly uh, epilepsy. There is partial and generalized one, simple and complex. Simple mean patient is conscious, complex mean patient is unconscious. Generalized, there is tonic clonic, myoclonic, absence seizures could seen in children, and febrile seizures, and also status epilepticus, which is exacerbation of epilepsy. And classification of antiepileptic drug, actually according to drug class that we classify this, but it is better to remember according to mechanism of action and what are the example of the drugs for the classification of antiepileptic drugs. So however, for drug classes, first we use barbiturates. Mnemonic is patients present more. First P is for phenobarbital or phenobarbital. Second is for primidone. M for methylbarbital. So nowadays, phenobarbital is not very used clinically due to that higher side effects of that. We talked in barbiturates video about that. And hydrantoins, example is phenytoin. When you talk about penicillin, you have to know what is penicillin toxicity, what is the therapeutic dose, what is the mechanism of action, and this is not only antiepileptic drug, this is an anti-arrhythmic drug also. And immunostil, mnemonic is cool. You could use carbamazepine, and succinamide, mnemonic is easier, ethosuximide, and oxazolidinediones, mnemonic is trimmed. Trimmed drug is trimethadione. And also benzodiazepine, mnemonic is calming drug. C for clonazepam, D for diazepam. And GABA transmitter inhibition enhancers like vibrant value, there is valproic acid and vigabatrin. New agents also, which are GABA analogs, lamotrigine, lamotrigine, topiramate, vigabatrin. Um, so mechanism of action and which drugs are used. So you have to know that why do we enhance the GABA activities. There is a third one, GABA mediated inhibition enhancement, because gamma is an inhibitor neurotransmitter. In the brain, there is a neuron which inhibit action potential. They try to reduce them, and from that we could try to reduce the enhanced electrical impulses which is causing epilepsy. And also sodium channel blockers, we know when sodium channels are blocked, no action potentials. For action potentials, for the depolarization, we need sodium. Without sodium, nothing happens. And calcium channel blockers for relaxation. So we know the what are the mechanism of action, what are the drugs that they are belong to. Sodium channel blockers, there is a phenytoin and valproate and lamotrigine and carbamazepine. And calcium channel blockers, there is ethosuximide and valproate. And GABA mediated inhibition enhancement, valproic, vigabatrin, benzodiazepine, phenobarbital, and topiramate. So nowadays phenytoin is widely used. Mechanism of action is a sodium channel blocker. Uses is anti-epileptic and anti-arrhythmic medication. They are used mainly in generalized tonic-clonic seizures and simple and complex partial seizures. Drug class is hydrandione. You have to know this is antiarrhythmic medication also. So this is belong to first class, which is a sodium channel blockers. You have to remember that some potassium channels, no. So S means sodium channel blockers in antiarrhythmic classification of medication. Famous side effect of penicillin is gingival hyperplasia, and others are anemia, nystagmus, hirsutism, teratogenic epic, They have teratogenic effect, and therapeutic range is 10 to 20 micrograms per milliliter. And one other thing that need to mention here that they metabolize by liver. Pentone is metabolized by liver using P450 cytochrome enzyme. And cytochrome P450 inhibitors, what happened? They inhibit P450 cytochrome enzyme in the liver, so penicillin cannot be metabolized anymore. So penicillin accumulate in the plasma. And example that cytochrome P450 inhibitors are amiodarone, cimetidine, and metronidazole. And on the other hand, some drugs they induce this enzyme and they will rapidly decrease pentone concentration in blood, like rifampicin and barbiturates. Toxicity causes purple glove syndrome, and I put a picture here which is taken from the internet, and this is right hand of an 81-year-old woman after 24 hours IV penetrating. So you could see her hands is getting purple color. This is called penetrating toxicity. In purple glove syndrome, we could see